Thank you, Dr. Xu, and wish the 5th World TCM Acupuncture Week a success. So let me share the screen. Okay, in this opportunity, I would like to share some experience and the protocol, clinical practical protocol for migraine prophylaxis. First, I will introduce the basic information about the headaches. So based on the Merck manual, a headache was categorized by 3 kinds: tension headache, migraine, and a cluster headache. And a migraine is very commonly seen in the acupuncture clinic, and we should know more about this. So according to the International Classification of Head Disorder, the 3rd edition, the diagnostic criteria for migraine include migraine without aura, migraine with aura, or chronic migraine. So especially for chronic migraine, it's a headache suggestive of migraine or tension headache more than 15 days per month or for more than 3 months that fulfill the following criteria. So it could be occurring in a patient who has had at least 5 attacks, meeting the criteria for migraine without aura or with aura, or both. More than 8 days per month or more than 3 months, featuring migraine and with those above 2 types. And so those the basic the diagnostic criteria. The patient also has the visual problems, sensory, speech, language, and nausea, vomiting, photophobia, so all those kind of symptoms accompany it. So you're familiar with those kind of patients. So there are a lot of migraine triggers. So especially those kind of, you can see the alcohol, the smokes, those kind of perfumes, and very good chocolate, nice food chocolate. And this is Chinese food, and especially for the MSG, and that's also could be the trigger for migraine headache. About the coffee, and the coffee doesn't cause the migraine headaches, but if you are coffeeaholic, every day have 1 cup of coffee, and sometimes you have no chance to have coffee, that will cause the triggers. And this will see the pattern, the sleep pattern difference alternate. So like a nurse practitioner, they have a different shift, night shift, day shift every week, different. Those also will be the trigger for the migraines. Especially the recent stressful life, and migraines actually is very common theme. So migraine are complex neurological events involving both neuron and the vascular mechanism. It's thought that the combination of genetic predisposition, environmental triggers, as I mentioned in the above, and a neurological factor contribute to the condition. These factors can lead to abnormal brain activity and affecting the nerve signals and the chemicals and the blood vessels, especially the trigeminal ganglion and sphenopalatine ganglions, and called dilating of the blood vessels, dural blood vessels. So that's the major anatomy and pathogenesis of migraines. So when according to New England Journal of Medicine, there were articles talk about the algorithm for the clinical management of migraine, including the first-time treatment and preventive treatment. Unfortunately, the acupuncture was not listed, mostly the chemical drugs. So I hope for the more clinical evidence, and we should have a consensus with those kind of algorithm, and that will be helpful to be a guideline, clinical guideline for acupuncture, what times and what to do. So that's important. And in recent years, lots of evidence talk about the acupuncture applied to treat headache and migraine. So in Milestone Conference of Consensus Statement on Acupuncture in 1997, headache was listed as acupuncture may be effective as an adjunct therapy, an acceptable alternative, or as a part of comprehensive treatment plan. In 1980s, and the World Health Organization and the list of 43 effective indications for acupuncture was a very pilot study based on a pilot study, but very influential. At the time, I was still in China, but also has the knowing of this very important 43 effective acupuncture indications. In later 2003, they modified and added more, like 180 indications, and then relate to different categories. So headache will list the disease and disorders for which acupuncture therapy has been proved through control study to be an effective treatment. So that's the high level of the recognition for acupuncture in the medical field. If we look at the PubMed and find the acupuncture in the treatment of migraine and those related articles, total about 664 articles, and especially after 2005, the new century, and especially in recent 10 years, the article has significantly increased. So 2020 to now, so now is June 2025, so it has not, it's already have 232 articles. So it's the most distinguished article about the migraine headaches in 2004. This British scholar, Andrew Vickers, and he used to work in New York, the Memorial Sloan Kettering Cancer Center. And he's one of the important articles talk about the systemic review of acupuncture for low back pain. So in this article, and whatever in the future, you have more clinical trials, either in favor or not favor to acupuncture treatment for low back pain, need 50 more. So it's very solid evidence of acupuncture in treating low back pain. But today I'll talk about the migraine headaches. So he used some kind of trial and also relate to the sociology or those kind of data, the quality of the life. So that's for acupuncture treatment. And the patient had a headache, and acupuncture treatment, they will experience 22 fewer days with headaches, and 15% less medication, and maybe 25% fewer visit to their doctor, and take took 15% fewer days off, sick days off from work than the control group. So this at that time was a very important. In 2012, and a starter has an article about acupuncture for migraine prophylaxis. This is for the prevention. So it indicates many articles talk about acupuncture treatment was successful for migraine attack, episodic attack. But this started with talking about the prevention. Prevent the new episode of migraine. The Professor Liang Fanrong, in Chengdu University of Traditional Chinese Medicine, and his team until now has very active in the evidence-based the research. In 2016, that's very important white paper from Cochrane Library. So Cochrane Library is the headquarters of the data center of evidence medicine. It's the white paper has a review for acupuncture for the prevention of episodic migraine. So the conclusion is positive. Acupuncture can be considered a treatment option for patients willing to undergo this treatment. As you know, not so many indications has been proved either clinically effective, I think also clinically effective, like a Bell's palsy, but in the systemic review or meta-analysis, and based on the very solid evidence-based medicine study, we cannot get positive feedback or the conclusion. But migraine headache is the one, and not only to treat the migraine, but also for prevention. And then the same in the Chengdu University of TCM, and they published an article, The Long-Term Effect of Acupuncture for Migraine Prophylaxis in the JAMA International Medicine. So there's very high influential factors. So that's the very solid conclusion. You see, this is the waiting list. This is shame acupuncture. That's the true acupuncture. So in 24 weeks, and we'll see significant decrease. That's the long term. In 1 to 4 weeks, in 5 to 8 weeks, and then flat, almost 17 to 20, little bit going up in 21, 24 weeks, still lower than in 1 to 4 weeks. That's the baseline before the treatment. So it's very significant. In 2020, also another systemic review, and I found the quality of evidence. So, and also could be the superior to Western medicine. In 2020, and also another article talk about the migraine prophylaxis. The team in Chengdu University of TCM and still working on this topic and a very in-depth study. In 2024, they published a new article and acupuncture for migraine, a systemic review and a meta-regression of randomized control trials. So they find the result, the study recommended 16 sessions of acupuncture with a frequency of 3 sessions a week and treatment duration of 1.5 to 2 months. So this is actually will be very helpful for case management, and you can tell the patient that's the solid data show how often you should come. So in the Western society, probably 3 sessions a week is impossible, but at least you can try to 2 sessions a week, right? So that's the solid data. And so we always say translational medicine from this kind of data and from bench to bed. And also, as I say, it's from the evidence to practice. And that's the importance we had to share with the patients. So we talk about the clinical protocols of personal experience. The migraine headaches, I think, also could be different kind of factors, but the most important exopathic invasion is the wind, and interior disarrangement, mostly related to the liver, and also bladder-stasis, wind fine or bladder-stasis. They're more like associated with the episodes of the migraines. In Lingsu, miraculous pivot already mentioned what kind of the channel will be related. So it's a mostly gallbladder channel and the urinary bladder channel points will be more important. And those in a different kind of classics mentioned those kind of points. So that's, I think I will try to skip this. But something very interesting, the treatment, they has to, ask the patient to cooperate on doing something, or not only the acupuncture and doing the moxibustion. So is the patient inhale, exhale 3 times, and then those kind of coordinate, and it will improve the therapeutic effect. But that's very interesting, but because of time, I'll not elaborate to details. This is the standard of the from Chinese medicine, Chinese acupuncture and moxibustion society, the evidence-based clinical practice guideline that including during the episode, it could be the breathing technique, and it could be acupuncture or electroacupuncture and pyroacupuncture. But the pyroacupuncture is a weak recommendation. The breathing technique and the acupuncture, that's a strong recommendation. And during the interval time, and mainly with the Shaoyang channel, and they use combination of comprehensive plan, acupuncture, scalp acupuncture, that means body acupuncture, scalp acupuncture, electroacupuncture, warming needles, and the breathing technique, the combination. That's a strong recommendation. And also in 2021, the Neurological Society, Neurology Society, also they organized a discussion for the non-pharmacological pain management for migraine. So that's also the similar results. So that's information. That's the during episode of filiform needles, or during episode of different kind of moxa, scalp, acupuncture, breathing technique, pyroacupuncture, and ear points. During the intervals, and so that's more important today. We're talking about the migraine prophylaxis. So according to the experts' consensus, they were including those kind of types, could be liver yang rising, turbid phlegm, or bladder-stasis, and in some cases maybe insufficient qi and blood. So the main points including Du28, GB28, GB8, Taiyang, and distal use Sanjiao5 or GB34. This is the one protocol, and I mentioned could be more concise, and this the clear and disperse the liver and the gallbladder, and actively channel relief pain. Use the Sanjiao 23 and joint puncture to GB8. Sanjiao 23 to GB8. And also the foot will be applying GB41 and GB20. So those method is very similar with the my mental mentioned points, and the lineage of the Fang's acupuncture style. It was the inherited intangible cultural heritage list of Shanghai municipal government, and that's my mentor, Dr. Fang, and he tried to use posterior Taiyang and similar, and going to the lateral, and similar with this method. Because we go to, that's from the Sanjiao 23, but Dr. Fang tried to use the posterior Taiyang, going this direction, horizontally insertion. And the GB41 also is very important. And he discovered when a patient had an episode, it will be very tender on the same side, GB41. And at this point, it's between the fourth, fifth metatarsal bone, but the lateral to the ligament. So we should be careful with the needle direction. The needle is supposed to be between two bones. If you insert a needle, insert the skin, and directly touch the bone, it's not right place. So that's the experience and those kind of important points, GB20, as he also mentioned. And he also finds some C3, there's C2, there's C3. Spinal process has some kind of nodule. So that will be very helpful, especially for the migraine, frequently happened, and for prevention, that's also will be very important. So in 2021, I published the article From Evidence to Practice, as this the meeting importance of developing guidelines for clinical practice in migraine prophylaxis with acupuncture. So I think it's very important during the intervals how we can use acupuncture treatment to intervene and prevent the new episode of the migraine attack. So those are all the considerations. The body constitutions, as my observation, many migraine headaches has the qi stagnation, liver qi stagnation. But according to the different articles, because there are total 9 body constitutions, they find not only the qi stagnation type, but also has the blood stasis type and the indeficiency. So corresponding to those body constitution, and we can set up the point to dealing with this problem. How can I know what the body constitution I belong to? They have I didn't put this barcode, sorry. You can Google. The Chinese version, and it has the you can directly go into the questionnaires, and to the end, you will get immediate score what the body constitution you will be. And in English version, unfortunately, you had to print out the form. You check out each question, and then sum up the scores, and then you will find what body constitution you are. Unfortunately, I tried many websites. I couldn't find in English version, only in Chinese version. they have an app can directly tell you the body constitution after you complete the survey. Syndrome analysis also very important, mostly if related to Zangfu organ and is a liver-related system, liver stagnation or related to the Shaoyang channel. So that's a soothing the Shaoyang. So GB20 always number 1 point to taking care of this. And the other thing could be blood stasis or the phlegm accumulation. And we should be careful about the needle acupoint selection. So fewer points will be better. And also based on the situation, usually we use the reducing methods. I mean, this other modality as described in the guidelines. So the treatment plan, how many visits is better, and how long the duration now has solid evidence. Those are the points I think can be added, and with those kind of different syndrome differentiations. It's very important for the migraine headache patient. They have to adjust the work routine and avoiding like night shifts, be relaxed, and also doing the meditation and like a qigong, tai chi, and also be careful with the food. Of course, avoiding the smoking, no smoking, no alcoholic, and less chocolate, as we say the trigger. Unfortunately, less going to Chinese restaurant for delicious food, or you can do at home and without SG, MSG, without MSG. So that's the plan. We share the information with the migraine prophylaxis. It's very, very important. They have a solid evidence there, and the practitioner should share those with the patients. And not only during the episode you come for treatment and in advance, and then you should continue to acupuncture treatment to prevent the new episode. So I think the time's up. So thank you very much, Dr. Xu, everyone.
Okay, thank you, Professor Chen. Thank you for sharing your research, your knowledge, and experience. Thank you very much. Thanks.